Hi, everybody. It's Cookin at the O in the time of COVID-19. Welcome. We're so glad you're here. We've missed everybody so much, and we're going to have a great show tonight. The music is going to be wonderful. We're so proud to be partnering with our local hospitals. We want everybody to just show the love for Cloquet Memorial Hospital, Moose Lake Mercy Hospital in Moose Lake, Riverwood Health Services in Aitkin, and St. Luke's Hospital in Duluth. We're just so honored to be able to partner with these great places that are keeping us all well. And they're so grateful to all of you for doing what Scott did, clean up the mic, wear the mask, tell each other we love each other in all the ways that allow us to be a little bit of apart, but really close together. Here they go. You're just going to love it. Thank you.
Never could carry a tune, never knew where to start. You came along when everything was wrong and put a song in my heart. Dear, when you smiled at me, I heard a melody. It haunted me from the start. All nature seemed to be in perfect harmony. Zing went the strings of my heart. 'Twas like a breath of spring. I heard a robin sing about a nest set apart. All nature seemed to be in perfect harmony. Zing went those strings in my heart. Your eyes made skies seem blue again. What else could I do again but keep repeating through again that I love you, I love you. I still recall that thrill. I guess I always will. I hope 'twill never depart. Dear, with your lips to mine, oh, rhapsody divine. Sing when those strings of my heart. Your eyes made skies blue again. What else could I do again? Keep repeating through again. I love you, yes, I love you. I still recall the thrill. I guess I always will. I hope 'twill never depart, dear. With your lips to mine, a rhapsody that's so divine. Sing when those strings of my heart, sing when the strings of my heart. It was a magic moment. It was a wonderful. It was a wonderful place to be with you.
Yeah, that's right.
Good evening, everybody. We're so happy to be here with you at the beautiful Oldenburg House up in Carlton, Minnesota, and we're enjoying our time here in the north country of Minnesota. Billy and I were out on the canoe today fishing, and we've had wonderful meals and just a wonderful time, and we're here for such a great cause. It's wonderful artists. At this time, we have an incredible opportunity to give our gift, to contribute our gift to help an incredible, unbelievable organization like this that's giving donations tonight. We hope that you can help contribute, by the way, to 4 different hospitals here in the northern Minnesota area. And so we're just doing our small part as musicians to add our music to the mix. If you can click the link below and give contributions tonight, we would be oh so grateful, because there's hospitals up here in northern Minnesota that are every day that are fighting against this pandemic, and so any contribution that you can give to help all those hospitals would be so appreciated. But we're going to just keep playing some wonderful music for you today. We have my dear friend Billy Peterson on the bass, and a new friend of mine, Mr. Glenn Swanson, on the drums. Billy and Glenn have known each other for many, many years, and Glenn and I just met 2 days ago. We've been playing music up here. We've been having a great time, and we're going to share a song with you now, a lyric by the wonderful Alan and Marilyn Bergman. When lonely feelings chill the meadows of your mind, just think when winter comes, can spring be far behind? The secret of a rose is merely that it knows you must believe in spring. Just as the tree is sure its leaves will reappear. It knows its emptiness is just a time of year. The frozen mountain dreams of April's melting streams, how crystal clear it seems. You must believe in spring. You must believe in love and trust it's on its way. Just as the sleeping rose awaits the kiss of May, so in a world of snow, of things that come and go, well, what you think you lack, you can't be certain of. You must believe in spring and love. Just as a tree is sure its leaves will reappear, it knows its emptiness is just a time of year. The frozen mountain dreams of April's melting streams, how crystal clear it seems. You must believe in spring. must believe in love. And trust it's on its way. Just as the sleeping rose awaits the kiss of May, so in a world of snow, of things that come and go, well, what you think you lack, you can't be certain of. You must believe in spring and love. Nice, boys.
The masked man. Who's the masked man?
It's me.
Well, as I mentioned, tonight we are going to be gathering funds for 4 hospitals that are doing an incredible job fighting this pandemic. And we have 4 people that are going to be speaking this evening about their experiences. And the first of those is Dr. Charity Reynolds from the Fond du Lac Reservation Clinic. So we're going to hear from her now.
Hi, good evening. Thank you so much for having me today. Thank you for giving me a few minutes to talk about my experience and our experience. I'm the medical director for Fond du Lac Human Services Division in Cloquet, Minnesota. In the very beginning, the Human Services Division, the medical team, the staff, the tribal leaders got together and started learning as much as they could about COVID-19. As they learned about COVID-19, they thought about what's the best way to protect our community and the safety of all people. We started not having face-to-face patient encounters to protect and to think of the best way to get together and to protect our community. So we got together and were able to do telehealth visits right away. We have been able to do screenings to protect the community. The most important part is being able to care for those that are most vulnerable. As you may know, Native Americans are most vulnerable to COVID-19 due to historical trauma and health disparities. So we want to make sure that our elders are protected. They are the culture and the history of the community. So we are very grateful that the tribal leaders and everyone has come together to help them. We ask that we continue to socially distance, that we continue to wear our masks when we're out and about, continue to wash our hands and do everything that we can to keep COVID-19 away, because it is important for everyone, for you, for us. And so we thank you so very much for everything. Thank you again. Be well.
Must you dance? Every dance. With the same fortunate man. You have danced with him since the music began. Won't you change partners and dance with me? Must you dance quite so close, with his lips touching your face? Can't you see I'm longing to be in his place? Won't you change partners and dance with me? Ask him to sit this one out, and while you're alone, I'll tell the waiter to tell him he's wanted on the telephone. You've been lost in his arms ever since heaven knows when. Won't you change partners, and then you may never want to change partners again. I'll tell that waiter to tell him he's wanted on the telephone. You've been lost in his arms ever since heaven knows when. Won't you change partners, and then you may never want to change. Never want to change. You may never want to change. You may never want to change partners again. It's Mr. Glenn Swanson on the drums, Mr. Billy Peterson on the bass. I'm Andrew Walesch. We're so happy to be here with you. We hope you get at least a second tonight to join us on this live stream. We're going to be live until, who knows, maybe even 9 p.m. tonight, maybe even 1 a.m., who knows. We're going to be joined by a whole bunch of wonderful guests, doctors and nurses, talking about their experiences treating COVID patients, the incredible work they're doing. And we are asking if you would hit the donate button below, if you're able to, and make a contribution to help these 4 hospitals up here in northern Minnesota that are doing such great work on a daily basis. We'd like to try a song by a wonderful songwriter from the city of St. Paul, Minnesota. He now lives in Portland, Oregon. He's still with us, but he was out in New York City for most of his career writing wonderful tunes for singers, and his name was Dave Frischberg. This is a song about having a little taste, a little glass of wine, a gin and tonic, whatever suits your fancy as you're sitting home enjoying live jazz tonight. I'd like to try it for you now. A little taste might hit the spot. A little taste might help a lot. It may be nice, but maybe not. In my condition, this is a risky proposition. A little taste might pave the way. It has been known to save the day. One little taste might be okay. It's a sedation, good for a sticky situation. Why not spare myself a little pain? It wouldn't hurt. And why leave my appetite out in the rain without a shirt? Who said self-denial's all that great? It sure wasn't me. 'Cause I've found that it often pays to dissipate. One little taste could make a whole lot of difference.
maybe it'll ease the bite. One taste might help me make it through the night. Good evening, friends. Why let those good intentions get my goat and bring me down? When I've found a great potential antidote, one little taste could change my whole disposition. One little taste might break the ice and make the nasty seem like nice. One little taste, just once or twice, it's an enhancer. One little taste could be the answer. And so it shouldn't be a total waste. Waiter, I think I'll have a little taste. Put it on her tab.
Ladies and gentlemen, thank you so much again for tuning in tonight. We're going to end this set with a beautiful ballad before our next speaker, and this is a wonderful tune that I learned from Mr. Frank Sinatra, a great tune by a couple buddies of his by the name of Jimmy Van Heusen and Sammy Kahn, and it's a wonderful song of hope.
Today I may not have a thing at all, except for just a dream or two. But I've got lots of plans for tomorrow. And all my tomorrows belong to you. Right now, it may not seem like spring at all. We're drifting and the laughs are few. But I've got rainbows planned for tomorrow. And all my tomorrows belong to you. No one knows better than I that luck keeps passing me by. That's fate. But with you there by my side, I'll soon be turning the tide. Just wait. As long as I've got arms that cling at all, it's you I'll be clinging to. on some bright tomorrow. Will all come true and hold my bright tomorrows belong to you.
This is a time to hear from another speaker, but I don't think they're quite ready at this time. So we're going to play one more quick tune for you about the simplest gift that you can give to anybody. A simple smile.
When you're smiling, the whole world smiles with you. When you're laughing, the sun comes shining through. But when you're crying, you bring on the rain, stop your crying. Be happy again, keep on smiling. When you're smiling, the whole world smiles with you. When you're crying, you bring on the rain, stop your crying, baby. Be happy again and keep on smiling. When you're smiling, the whole world smiles with you. The whole world smiles with you. The whole world smiles with you.
As you can tell, folks, we're not having any fun up here tonight. We're having a blast. Mr. Billy Peterson on the bass, Mr. Glenn Swanson on the drums.
Thank you.
Sounds so great, brother.
Andrew
And
Walesch.
my name is Andrew Walesch. We're having a great time. We appreciate you tuning in tonight. And we have another guest on the line here. And we're going to hear from Dr. Chris Delp from St. Luke's Hospital.
Good evening, everybody, and thank you so much for listening. I'm Dr. Chris Delp, and this is my wife, Cass. And yesterday, I was broadcasting from St. Luke's Emergency Department, a little head. Uh, as you may have heard, the Twin Cities are filling up with intensive care beds, and they're starting to arrange for transport for people from the Twin Cities up to Duluth. So the surge is certainly starting to begin to affect us, and that's why I appreciate what you're doing so much. Glenn and Emily, always the most lovely of hosts. And this time, tonight, I get to listen to Andrew and Billy, and of course, Glenn. The Oldenburg House is our favorite date place to go. The music and the food there is always wonderful. Today, for us, for me, we're raising money through St. Luke's Foundation, and St. Luke's is providing funds to provide for personal protective equipment, as well as to provide all of the things that we need to adapt to this crisis. There's new equipment, new adaptive strategies, repurposing old things, and into new ways for us to use it during the crisis. So it directly impacts us. It directly impacts all of us, me as a physician, but the people that I care for. And I think that's the most important part is I want to do the best job that I can for all of us. The people that are listening, you all are my friends and family, and we certainly want to care for you. And we now, I think, have the ability to do so, but there's still needs. There's still a lot of needs to meet this crisis, and I'm overwhelmed with how people have really come out to help all of us. There's the things that I've seen pouring in, the innovation from Cirrus to develop filters for the practicing physicians, Frost River for making personal protective equipment, the PPE, the PAPR hoods, these people that have all really pulled together. The entire community, I feel, is behind us. And I just, it's so heartwarming to see. I know it's difficult. It's really difficult, this pandemic, not being able to hug and to touch and to socialize. I think it's been really hard on all of us. But being on the front lines and seeing the effects on patients every day that I go to work, it's so important what everybody's been doing, every effort that's been made. I'm just very grateful to all of you for everything that you've done. But thank you for listening. Thank you for donating. We both very much appreciate it. And for me, this is a night off for me, so I get a chance to have a little bit of wine, enjoy the music of Andrew, Billy, and Glenn. And this, to me, is our night in rather than our night out. But thank you all, a very heartfelt thanks, and know that we're always ready to take care of you. We've got the staff that are happy, willing. We're all here to care for you, and we're all here really to care for each other. Thank you so much.
One, two, three. Everybody has the right to be wrong, at least once. Everybody has the right to be dunce, like once, like not being too smart is no mistake. What sets you apart is smiling with egg on your face. It's naive to make believe that you're right. It's not right. Only fools go walking on thin ice. Twice you and life can skip the strife, and you both get along. All it takes is simply saying you're wrong when you're wrong. And everybody has the right to be wrong. It's naive to make believe that you're right. It's not right. Only fools go walking on thin ice. Twice you and life can skip the strife, and you both get along. All it takes is simply saying that you're on when you're on. Everybody has the right to be, and it is a real delight to be. I'll fight for the right to be wrong at least once. Sir Glenn Swanson on the drums, Mr. Billy Peterson on the bass. I'm Andrew Walesch. Thanks so much, ladies and gentlemen. And we're going to follow this up with a tune that we decided to play at the last minute. We thought maybe this isn't the most appropriate tune for this broadcast because the title is Nothing's Going to Be All Right. But the reason why we want to play this is because we all agree that when you let go of control in life, like we all have to right now, that's when you get true freedom. And that's when you can really, truly feel grateful for what you have. Don't worry about a thing, because nothing's going to be all right. A very sarcastic tune by the great Mose Allison. And if you listen to the lyrics, I think you'll agree this is the exact right tune for what we're all going through right now. Thank you, Mose. Billy had the pleasure of playing with Mose many, many times over the years, and he's not with us anymore. But what a beautiful songwriter and a beautiful, wonderful human being. It goes like this. If this life is driving you to drink, you're sitting around wondering just what to think. Well, I got some consolation. I'll give it to you if I might. I don't worry about a thing, 'cause I know nothing's going to be alright. You know, this world is just one big trouble spot, 'cause some have plenty and none have not. You know, I used to be troubled, but then I finally found the light. Now I don't worry about a thing, 'cause I know nothing's going to be alright. What you gotta say, Billy? Don't waste your time trying to be a go-getter. Things will get worse before they're gonna get better. You know there's always someone playing with dynamite. Now I don't worry about a thing, 'cause I know nothing's going to be alright. Did you hear me? I said if there's nothing worth worrying about you just gotta sit there and say it's all gonna be all right. It's all gonna be all right. Thank you very much. It's all going to be all right is the truth. We wouldn't normally say that if we were playing that tune, but for the purpose of tonight, we will. Thanks again for joining us, Mr. Billy Peterson on the bass, Mr. Glenn Swanson on the drums. My name is Andrew Walesch, and we're here at the Oldenburg House. Such a beautiful place to be up in Carlton, Minnesota, raising funds tonight for 4 hospitals that are working day and night to keep people safe as they can be and as healthy as they can be in the middle of this terrible pandemic. And we now have another guest, and please welcome Dr. Ken Ripp from Community Memorial Hospital.
I want to thank Emily and Glenn for giving me a chance to speak. I'm Ken Ripp. I'm a family doc here in Cloquet. You know, I really love what Glenn and Emily have done at the Oldenburg with the fine food and the outstanding entertainment. I really look forward to getting back to their live shows sometime in the future. So Glenn and Emily asked me to come out and talk a little bit about what has changed for medicine for me and what I see the future of medicine with this pandemic. So the pandemic has been brutally hard on everyone. It's created change at lightning speed, which is always a challenge and causes stress. Overnight, elective procedures and routine office visits stopped. As a family physician, I work in several different capacities and entities, from the hospital to the clinic, to the nursing home, to the ambulance service, to the county jail. And I've witnessed people just working so hard to prepare for this pandemic, and we're starting to see it roll in now. I'm proud of the healthcare team and how much time they have given and their expertise to get ready for this. It is challenging just to try and keep up with the changing recommendations, and we're all trying to constantly improve our knowledge and be best prepared to care for our community. I believe that the measures that we've taken so far at the state, town, and school levels have really helped slow this virus down and has spared our community of an overwhelming surge. And it's allowed us critical time to get our supplies up and to get ready to plan for what's going to happen next. Things have really changed at the clinic for me. You know, patient volumes initially fell off almost to zero. We're now wearing personal protective equipment with every visit and are working hard to clean like never before. The protective equipment is not new for us, but the wearing it constantly and the amount of protection is. It is a challenge because it does put a little bit of barrier between us and our patients, and it's hard to sometimes read the patient's reaction, and even interacting with providers with masks and respirators on sometimes can be a challenge. And I can only imagine how frightening it is for our patients to be cared for when they're sick and maybe a little bit confused with a team of providers dressed in full protective equipment. Don't get me wrong, this protective equipment is absolutely critical because healthcare workers are getting sicker at a higher rate and are having worse outcomes than the general population. So although this is a barrier to our care, it is absolutely necessary. the use of this protective equipment will be going on for the foreseeable future. So at the clinic, we have different groups meeting constantly to try and discuss the changing needs and how best to care for our patients. We're trying to adapt to this change with the pandemic. We had to alter how we collect certain samples, and now we have a fish house out in our parking lot to collect certain samples. Our Coumadin clinic is now going out to meet our patients in their car to collect their little blood sample. People have been very adaptable to these changes. I want to thank all the healthcare workers who have been made these changes without much complaint. We have a new telehealth link at our clinic, and that's been a change. It took a while to work out the technical glitches, but overall it works. It is fun to get a tour of some of my patients' house when we're on the phone. So telehealth is not going to go away, but it cannot completely replace that one-on-one personal interaction that happens in a clinic. So it has been hard to deal with critically ill patients, and it is really asking a lot of our healthcare team to put themselves at risk. Many of our 46% of healthcare workers are now altering how they interact with their own family. Some are not even going home anymore. That is sad. We don't want to get ourselves sick, and we certainly don't want to get our families sick. It boils down to this: good science will help us figure out the ins and outs of this virus. Good science will find treatments that work and those that do not. Good science will hopefully lead to an effective vaccine in the near future. For those at home, it can be a very stressful time with all these changes. Please be safe, wash your hands, reach out by Zoom and whatever other methods you have to keep in touch with your family members. Know that our healthcare community is trying desperately to protect you, your family, and especially our senior members in our community. I know that is only with science that we're going to get through this. Glenn and Emily, look forward to seeing you again real soon. Thanks for this opportunity.
Something happens to me in your arms when I can feel that you are near. A strange kind of a chemical force goes rushing through me. I know that mysterious glow means you'll appear. Then, baby, something happens to me in your arms when I can feel you're trembling too. I can tell that you have been caught in the spell that I am under. We gaze into each other's eyes with breathless wonder to see that when something happens to me, it happens to you. Something happens to me in your arms every time I feel that you are near. It's a strange kind of a chemical force that comes rushing through me. I know somehow that you are gonna appear. Then, baby, something happens to me in your arms when I start grooving too. I know that you have been caught in this spell that I'm under. We gaze into each other's eyes with breathless wonder to see that when something happens to me, when that magical force goes rushing through me, when something happens to me, it happens to you. How lucky a guy I've come to be since you changed me. Something happens to me. In yours, and I can feel your soul. Yeah. I can feel your heart and your body pressing next to me. It happens to me. It happens. That strange chemical force goes rushing through me. When something happens to you, it happens to me. It's just the way we rehearsed it.
That's right.
Exactly. This is really hard.
Ladies and gentlemen, we are raising funds tonight for a wonderful, wonderful cause. 4 hospitals that are in need during this pandemic. And please, if you can, look below and contribute, donate whatever you can to help these 4 hospitals that are fighting this terrible pandemic at a very challenging time for all of us. We are here as musicians, contributing what we can, which is our art, trying to bring some peace and some happiness to you. But it's a very small thing that we are doing compared to these incredible heroes. So
Amen.
if you can, please do what you can to help them out. We're gonna play. I think. Yeah, let's do that little. Do that little ballad that we were talking about earlier, which you still don't know what the heck it is, but that's okay. I like to keep them in suspense.
And we love that.
The shadow of your smile when you are gone will color all my dreams and light the dawn. Look into my eyes, my love, all the lovely things you are to me. Our wistful little star was far too high. A teardrop kissed your lips, and so did I. Now when I remember spring, all the joys that love can bring, I will be remembering the shadow of your smile. Our wistful little star was far too high. Teardrop kiss your lips, and so did I. Now when I remember spring, every joy that love can bring, I will be remembering the shadow of your smile. The shadow of your smile. Your lovely smile. Now when I remember spring, all the joy that love can bring, the shadow of your smile.
Next, we're going to hear from Danita Corpella. Danita from Mercy Hospital in Moose Lake.
Hello, my name is Danita Corpella from Mercy Hospital. I'm the Director of Patient Care Services at the hospital, and I've been there for 24 years, so it's been a long time. I just want to extend a thank you to Emily and Glenn for their generosity by putting on this music event. It's been a great event, and the music is wonderful from what I've heard. The money raised is definitely able to assist our staff and other hospital staff to care for their patients safely. And in this time that everyone is worried about exposure and things happening to them and going home to their families and bringing these things to their families as well. I think the community has done a great job in collaborating. I've definitely been a great part of collaboration between hospitals in the region, hospitals in the state. We've all pulled together and worked really hard. It's constantly changing. Some of these changes that we've seen have been technology. As you can see tonight, we're doing so much more over the technology. And yes, you lose a little bit of that face-to-face contact, but it's definitely keeping people safer at this time. The technology has allowed us to provide that care, collaborate with one another, and really be there for each other in this time where we can't touch each other, feel each other. We really want to socialize, and that technology has really brought us together. The community donations have been just absolutely overwhelming and thoughtful from our community to all of our staff. We've got everything from Girl Scout cookies that were just, even some of the Girl Scouts themselves just wanted to donate to the staff to show their appreciation and their thankfulness for us continuing to work and help those that they love. We got school children, the local schools brought thank you cards, and we got them posted in our facility just to keep people cheered up and know why we're doing what we're doing. The community is also, CDC has recommended source masking. So you come into a hospital and you're going to get a mask, and our community has donated so many masks to allow us to offer them to our staff and our patients. This is just one of the masks that we have. They're great. They help us keep each other safe, protect each other, and they also do cover some of our PPE that we're wearing in the hospital to keep that clean, because we're reusing equipment. But with the monies that are donated through this, then we will have plenty of PPE and plenty of supplies for our staff, so we can continue to take care of our patients the way that they need to be taken care of. It has changed the hospital. We haven't seen too many patients in the hospital. In some areas, it's totally shut down other areas. So we're very anxious to get people back and start doing our work and start providing our care to our community that we do a good job of. Some of our community members have put signs up, Heroes Work Here signs, in recognition of our staff, and they're posted out right by our Mercy Hospital sign. And So every day you drive in, the staff are heroes at this time, and we appreciate everything that they're doing. So I'm glad I was able to be a part of this event and to show our appreciation and our your generosity in helping out your communities and helping us work together. And we will get through this together and work together to be as safe as we can. So enjoy your time, properly social distance. We've been doing a great job, and our hospitals really do appreciate that. So thank you very much and have a good evening.
Hi, ladies and gentlemen. We're going to start this little set with a beautiful tune that truly is, I think, the best song of hope, right? The best is yet to come. Cy Coleman and Carolyn Lee wrote this beautiful tune.
Out of the tree of life, I just picked me a plum. You came along and everything started to hum. Still, it's a real good bet. The best is yet to come. Best is yet to come, babe. Won't that be fine? You think you've seen the sun, but you ain't seen it shine. Wait till the warm-up's underway. Wait till our lips have met. Wait till you see that sunshine day. You ain't seen nothing yet. The best is yet to come, babe, won't it be fine? The best is yet to come the day that you're mine. Come the day you're mine. I'm gonna teach you to fly. We've only tasted the wine. We're gonna drain that cup dry. Wait till your charms are right for these arms to surround. You think you've seen the sun, but you ain't left the ground. Wait till you're locked in my embrace. Wait till I draw you near. Wait till you see that sunshine place. Ain't nothing like it here. The best is yet to come, and babe, won't it be fine? The best is yet to come. The best is yet to come. Best is yet to come. Won't it be fine? Won't it be fine?
Beautiful, man.
Thank you, ladies and gentlemen. It looks like our guest isn't quite ready yet, so we're going to do one more tune for you. And we call this the COVID song because this crazy time that we're all living in, you're supposed to stay in your house and you don't get around much. So we're going to do a little Duke Ellington tune, lyrics by the great Bob Russell. Stay at home, be safe, and don't get around.
Saturday dance. Heard they crowded the floor. Couldn't bear it without you. Don't get around much anymore. Thought I'd visit the club. Got right up to the door. They'd have asked me about you. Don't get around much anymore. Baby, I guess that my mind's more at ease. But nevertheless, why would I stir up old memories? Been invited on dates. Could have gone, but what for? It's different without you. Don't get around much anymore. Oh, my darling, I guess that my mind is more at ease. But nevertheless, why would I stir up all those old memories? Been invited on dates. Could have gone, but what for? So different without you. I'm lonesome without you. Don't get around much anymore. I don't get around much. I don't even go to Cub Foods. Don't get around much. I can't get my hair cut. But I've made great friends with Netflix. And I've spent time with my family. And I find that I have a little bit less stress when I wake up in the morning. But I'm not getting around much anymore. Don't get around much anymore.
We have two more guests this evening that are going to say a few words, and our next guest is Chris LaFleur from Riverwood Healthcare Center.
Hey, everybody in the live stream world. Welcome back, and thank you so much to Glenn and Emily Swanson, the Oldenburg House, Oldenburg Arts and Cultural Community for putting on this live stream event. Big thank you to Ricky Peterson, Billy Peterson, and Glenn for playing some awesome jazz. Also, behind the scenes, we got Scott Lillo and Daniel Benoit. Big thank you for them for their technical expertise in making this happen. My name's Chris. I'm a nurse anesthesiologist at Riverwood Healthcare Center. We're a 25-bed critical access hospital with 3 primary care clinics and over 40 physicians in a wide range of specialty service lines. We offer a 24/7 emergency department with a level 3 trauma center and an airlift service. We're located in Aitkin. We serve Aitkin County, Garrison, Mille Lacs, Lakes area, and surrounding communities. Our focus is on patient safety and infection prevention, especially now with the COVID-19 pandemic. Over the last 9 weeks, we have developed policies and procedures to ensure the safety of our patients and community residents. On April 6th, we rolled out virtual video visits with patients and their providers, which is something that has been very well received and going very well. On May 11th, we resumed elective surgical procedures, and we now have extra precautions in place, including separate entrance for surgery patients. Fortunately for us in Aitkin County, COVID-19 illness has been very low with very few lab confirmed cases. And that's all due to our community, and we owe them a big thank you for the hard work in maintaining social distances, using masks, washing hands, and trying to kind of stay home and slow the spread. And we know that Memorial Day weekend is a big time to be out and about, so keep these things in mind. This virus has not disappeared. It's still out there, and we still have to do what we have to do to protect ourselves, and more importantly, to protect others. So as we work for you, please keep those things in mind so we don't have to care for you. Again, thank you to the Oldenburg Arts and Cultural Community and the Oldenburg House and all the fine folks that are putting on this live event, and we really appreciate it. Thank you, and be well.
Hey, bro.
Where has the time all gone to? Haven't done half the things we want to. Oh well, we'll catch up some other time. This day was just a token. Too many words were still unspoken. Oh well. We'll catch up some other time. just when the fun is starting. Comes the time for parting. Let's be glad for what we've had and what's to come. There's so much more embracing, still to be done, but time is racing. Oh well, we'll catch up some other time. There's so much more embracing, still to be done, but time is racing. Oh well, we'll catch up some other time. We'll catch up some other time. Mr. Billy Peterson on the bass, and our dear friend Mr. Glenn Swanson on the drums. Sounds so great, man. My name is Andrew Walesch, and thank you for joining us tonight. Are we ready for the last speaker? Not quite yet. Okay, we're going to do one more tune. Great. So, yeah, please see below in the explanation info section for where you can donate to these 4 hospitals tonight that we're playing for, that are in need of funds. And if you can contribute, please do. But we're going to play a tune, and then I think we're going to hear from one more speaker, and then we got one more song for you tonight. No more speakers. Oh. We're speakerless. Okay, I thought we had one more. So we're going to do one more tune and call it a night, huh?
There we go.
Sound good? Okay, great. Wonderful. So let's try this one. Is it an earthquake or simply a shock? Is it the good turtle soup or merely the mock? Is it for all time or merely a lark? Or is what I feel that real McCoy? Is it for all time or just a little lark? Is it Granada I see or only Loring Park? Is it a fancy not worth thinking of? Or is it at long last love? This is a little Cole Porter to take it out. Is it an earthquake or simply a shock? Is it the good turtle soup or merely the mock? Is it a cocktail, this feeling of joy? Is what I feel the real McCoy? Is it for all time or just a little lark? Is it Granada I see or Asbury Park? Is it a fancy not worth thinking of? Or is it at long? Is it at long last love? just a lark? Is it Granada I see, or simply Loring Park? Is it a fancy not worth thinking of? Oh, yeah. Or is it at long? Or is it at long last love? Or is it at long last love? Could I finally have found someone in my life? Is it possible that you're the one? Could it be true? Is it at long last love? Thanks so much for joining us tonight, folks. We thought, and we did have another speaker, but they are not going to be joining us tonight. We had 4 wonderful speakers, so you can roll the video back and listen to the wonderful things that they said. And then you can go and click on the donate button if you're able to do so below this video and support the 4 hospitals that we've been raising money for tonight. Thank you so much for joining us. Mr. Billy Peterson on the bass, Mr. Glenn Swanson on the drums. My name is Andrew Walesch. We have wonderful production back there with Daniel Benoit and our friend Scott back on sound. And we have wonderful hosts here at the Oldenburg House. We're so fortunate to have had the opportunity to be in your homes tonight, and we wish you all the best. Please be safe. We'll see you next time. Thank you.